Welcome to the Healers Café, conversations on health and healing with Dr. Manon.
So welcome to the Healers Café. And today I have with me Nawale Ayar. And let me tell you a little bit about her. She is a craniosacral therapist and vagus nerve certified. She received a one-year comprehensive extensive training at the first and largest and most established college of Cranial-Sacral Therapy in London, UK, while completing her anatomy, physiology, pathology certification in Minerve in France. Now, Nawale was uniquely trained in biodynamic craniosacral therapy and fascial unwinding as well, which is a biomechanical form of craniosacral therapy. So, welcome. And we have a few things in common to talk about on the physical level, because you may not know, but I run Bowen College. So I teach a therapy called Bowen therapy. So we have students that from all of these different backgrounds as well. And so what a fabulous opportunity to really talk about these therapies, what they are, what benefits people can get, what's different about them, and all of that. But before we start, I would like to find out from you, what got you interested in these healing modalities or in this path?
Well, hello. Actually, what got me interested in this is a very personal reason. I think I've heard this expression, wounded healers. So it's not very surprising that I end up being a craniosacral therapist. I was always interested in the health of my mom because she had a health condition from before I was born. So, it was always a little bit in the back of my mind, although I studied something completely different. And then I myself had a couple of episodes a year of what is called vasovagal syncope. So for those who are not 100% familiar with this, is just a fancy way to say fainting, and all the stages that happen before you actually faint. And so I knew it wasn't really dangerous, but it also wasn't completely normal. So I did my own research and stumbled upon something called the vagus nerve, which was going to be my favorite nerve. And so I researched about it and discovered that something called craniosacral massage, back then they were calling it a massage, would help release that nerve which was trapped in the body and creating many health conditions. And so that's how I discovered craniosacral therapy for the first time, which was really surprising because I expected a massage, but this person was hardly touching me. And it was really surprising. It was here in Vancouver. And I was that client who didn't believe in it, didn't believe in anything, didn't expect it, didn't feel anything whatsoever during the treatment. Yeah. Best client. And I really honestly thought that it was a scam because I've never seen a massage, with hardly any touching. Not that I knew a lot about it, but something completely magical happened at the end of the treatment. And I've never felt serenity this way. I've never felt aligned, clear-minded, happy, energized, full of love. It was, honestly, there is no other way to describe it but magical. And so that was my first encounter with craniosacral therapy. And it was literally life-changing because of that treatment, I decided to become a craniosacral therapist myself.
Well, that's a very compelling experience. It speaks for itself, the huge transformation. So can you explain a little bit more what that condition is? Because I think it's actually, a lot of people have it and it's misdiagnosed or misunderstood. What were you experiencing before? What were the sort of the symptoms? And tie it in afterwards. What does the vagal nerve do that could, by releasing it, have massive changes like that?
I love that you ask about this, because it's not a condition that a lot of people talk about and or are aware of. And, you know, you can just faint in the morning or once in your life and you get on with your life without even paying attention to it. But to some people, it can happen too many times in their lifetime. The reasons aren't really perfectly documented. In my case, because I had to become the investigator of my own crime scene. So I discovered that things like gluten and dairy would precipitate an episode. And so since I quit that, it became a little less frequent. And then craniosacral therapy with the vagus nerve work sort of put a stop to that. But in a few words, it's everybody is different, of course, but I'll just explain my situation. It usually happens early in the morning. It's not something that would happen to me randomly during the day or in the middle of the night. So it's when my blood pressure is really, really low. And I think it's also mixed with a bit of dehydration. And what happened is that I used to feel really weak and really feeling really hot and really cold at the same time, with a sad feeling of impending doom. And then I could hardly walk, and if I'm standing, I have to lay down, but my vagus nerve anyway would tell my nervous system that it's time for me to be in a horizontal position to keep me alive and to have my blood, you know, floating from my toes to my head, you know, at the same level. So I would have to sort of, I'm one of the lucky ones who have enough time to sit down and lay down on the floor. I use not to collapse. Right. And so, yes, and these are all the steps before completely losing conscious and technically fainting. In my case, which is, I don't know, if it's positive or negative, it just is what it is. I don't fully lose conscious. I used to just be completely conscious of everything that was happening. And so it's an extreme weakness, something that you cannot control. And unfortunately, it has an effect on the way you breathe as well. That's not something you entirely control. It's like something else is taken care of the way it wants you to breathe, slowly or fast or not. And in my case, it felt like hours, and it can be a few seconds, a few minutes, and yeah, you just can't do anything anymore until it passes.
Because like the vagus nerve, I mean, innervates also the diaphragm, the lungs. It's the longest nerve. And,
absolutely.
And also people who like it's from what I've understood. I'm not a specialist in it. I've just, by doing some trauma work, I know that it's often triggered, and if it's trapped in any way, can have real impacts in exaggerating the sympathetic response and less calming down.
Absolutely.
That you would have, you know, or in your case, it was like it's not really parasympathetic mode. you're in a suppressed state, right? You're not functioning with a normal balance of the autonomic nervous system, because absolutely. It's not firing how it should, right?
Absolutely. Yeah. What happened is sort of a little bit of a complex between the sympathetic, the fight or flight system that usually people knows it this way, and the parasympathetic, the rest and digest. And it feels like an alarm is set on inside the body, and then to respond to that, the parasympathetic wants to calm down things really, really quickly. But both of them, they clash, because it's like trying to go really fast with your car and pressing the brakes at the same time. So the only solution for the body is to collapse and to lay down on
Right.
the floor. It's too extreme, it's too much, and it happens in the blink of an eye. So this is what happens in those situations.
Yeah, very interesting. Yeah. So, well, why don't we go? I mean, maybe what is the thing, because you actually studied the vagus nerve for an entire year. What are you most surprised at or amazed at the power of the vagus nerve? What is it that
Yes, apart from the fact that yes, it is the longest, it's called the vagabond, and it goes from the top of the head until your abdominal region. I'm really surprised that not everybody is somehow certified in the health field in this nerve, because it's so important. What fascinates me is the mood change, how somebody could think that they are depressed for the rest of their life, and some vagus nerve manipulation could change their mood to happiness, and everything would be lifted off really quickly. This is shockingly impressive to me. These are the things that the vagus nerve can do. And on a physical, more physical than psychological level, I've experienced it myself, from feeling sluggish and lacking energy to feeling like you can conquer the world and want to run a marathon the next day. It is this powerful.
Yeah. So when you do craniosacral, because I know in osteopathy, actually, when I went to France, because I was teaching Bowen therapy there to osteopaths, there was a wide spectrum of osteopaths that only use the cranial, others use the entire body. And so I'm just wondering if you could speak a little bit to, I think craniosacral is your main skill, right? So maybe if you could explain to how it works a little bit, what it's like, how it differs from your understanding of osteopathy, and I'll chip in with Bowen as well, so people can
absolutely
get, because they're all kind of physical and they all have massive other impact, and they're a little different, right? So
I've actually heard of Bowen therapy a few years back, and I would actually love to know a little more. So that's really interesting that we're meeting today about both our fields. So just to clarify, craniosacral therapy, and I'm going to explain a little bit more about it, stems from osteopathy. However, that does not make me an osteopath. I am not. I was trained by one for 1 year at the College of Craniosacral Therapy. I'm a craniosacral therapist, but I'm not, although that could be interesting, I'm not an osteopath. So craniosacral sacral therapy is a portmanteau term. Cranial is for the cranium, the skull, sacral, the sacrum, the tailbone. So your craniosacral system is whatever happens between these two poles. And this therapy was invented by the father of osteopathy and his student back in the late 1800s. And so they were, like a lot of osteopaths, fascinated by the craniums and the bones of the skull. And so they noticed that there were some grooves around the edges of the bones where they would articulate or touch each other. Mm-hmm. And so they were wondering how come these grooves would be there. And so after many experiments, they understood that there is another rhythm in the body that helps these bones move. So it's another rhythm, aside from your cardiac rhythm or the circadian rhythm, there is another rhythm that is like a breath. It has an expansion and a contraction. It's also called the primary
or secondary respiratory mechanism or something like that.
Breath of life, something along those lines. And so this is in every living thing. It's in everybody. And so when you engage with that rhythm on a very subtle level, that's why craniosacral therapy is so gentle. It's a hands-on light touch, and the touch should be the weight of a butterfly, so it's really gentle, really light. So when you engage with that rhythm, you engage with the person's health on a very subtle level. If you wanted to engage with this person's muscle, you would just grab their muscle. And so to be able to engage with these healing abilities that are natural to the body, you would have to engage, thanks to craniosacral therapy, at that subtle and fundamental level. So we are trained to put our hands just very gently on the person's body. And when we feel that rhythm, we can feel that it's vitality. It's like a diagnosis. It gives us a diagnosis about this person's health, but it's holistic. So it's about this person's entire life and experiences and injuries and traumas and shocks and emotional blocks from the day they were born to the day they came to see you for a treatment. So when we engage with those forces, with those rhythmic motions inside the body, we can see where they are blocked, where, you know, they are weaker, what's happening inside the system. And just by the fact of engaging, the body, you know, starts to heal itself by itself through its own natural power.
Mm-hmm, mm-hmm. So, I mean, from what I've received some treatments, so I've experienced it, and yeah, it's definitely very subtle. I would say even more subtle than the osteopathic work I've had, and more subtle than Bowen therapy. So it's, I think, as gentle, but we work on different body parts. In other words, with craniosacral, I mean, the work was done mostly in my mouth, and also it was to put my sphenoid back in balance, because apparently my pineal gland was being crammed. So, you know, I can't tell, but they seem to be able to know this, and it was a very interesting experience, and I could really feel like, whoa, like my world was really, I could tell that there is an energy that I'm aware of, but that I don't have easy access to, you know. So it was a very interesting experience, and that was quite a few years back, maybe 20 years back. So, but I remember it as a significant one. But I do think, well, let me go back to it with Bowen. We do it, we're super gentle. We work with the fascia, and we go, you know, counter the layout of the muscle. So it's sort of on an angle to the way muscles generally lay in the body. So it's like a cross fiber manipulation. We also have the same fundamental understanding or belief that, well, belief, practice, I guess, that we notice that when we give the body information, it knows how to heal. So we're just giving the information and allowing the body to rectify and do what it needs to do. But we do touch most of the body. And I think when we look at the way your experience was, your first one, that is a very common, you know, we have patients, they get off the table going, and I'm supposed to pay for this, you know. So
Yes,
I think we share the same disbelief, but at the same time, because the body's so amazing, you give it what it needs, and then people have unbelievable, as in it's unbelievable because in our so-called modern day pharmaceutically driven society, there's no expectation to heal, right? Hi, I'm Dr. Manon Bolliger, and I wanted to take a moment to thank you for watching these podcasts. If you haven't subscribed, please do. Also, feel free to leave comments and like it. This way, more people get to find out about this work and about other choices for health. So I think it's really important that that we all share this information. I have a free gift to you. It's a 7-sequence email that has tips for every day, and it's a little insight about how to live your life when it comes to health. And it's very much built on how I managed to overcome stage 4 cancer and what it took. So I would love you to have this, and thank you once again for listening to these podcasts. Right? We're just managing symptoms and drugging more and more, and habituating ourselves to management. I think it's what it is. Which obviously these therapies are completely different.
To turn away from the natural, very powerful healing abilities that our body has and was born with.
Yes.
And to just comment a couple of things on what you just said, that is really fascinating. The fact that, yes, people don't really think this is going to be life-changing, and yes, they surprised that they would have to pay for this, but it takes them sometimes a week or 2 or 3 to realize, oh, everything has changed. And the only thing that was different in my life was that treatment.
Right.
So, and also because this is a holistic approach, it works on the entire body. Somebody, I'm just going to give a very basic example. Somebody can come and see you for an elbow pain, and then suddenly they don't have any digestive issues after the treatment, and they will never connect the dots that this was thanks to that holistic, natural approach. This is the first thing I wanted to add. And the second thing is that I was really lucky to be trained in the College of Craniosacral Therapy with Thomas Attlee himself. I'm really, really lucky that me and him are in the same lifetime. Because his approach is actually specifically called craniosacral integration. And what he does, I'm going to talk about it really roughly, is that there are technically 2 sort of schools in craniosacral therapy: the biodynamic, which is the one that I do and we explained, and then the biomechanical, which is more structural, and it sounds a little more what you just explained about your therapy.
Well, actually, it's funny. I'll stop you right here, because so the therapy, Bowen therapy, was named after a fellow called Tom Bowen from Australia. And it was very mechanical. He was not, but no one understood what he was doing. Mm-hmm. And so people who observed him, which were mostly chiropractors, he had 1 osteopath and he had 1 massage therapist. And it's almost like the lenses, the perception which they had on his work made it seem like it was mechanical. And so when I opened up my school, and so I was trained in the mechanical, but my experience was not mechanical. And because of my background as a naturopathic physician and also as working with trauma, and I went, okay, whoa, this is a deep integrative work.
Yes.
So then I started creating the consciousness of understanding the integration that actually takes place. So now when students come to learn this, they're looking at the body, but they're understanding that the fascia holds our subconscious, and all of this comes out to manifest in a certain order. And so they're becoming very attuned to a deeper healing than when you're looking at the world mechanically. And so I feel like there's actually a separation, which I felt necessary, because I think for me, the other side is just it's my experience in life. There's nothing wrong.
Absolutely.
It's just, you can't remove the lenses from which you see and observe the world and pretend that you don't see what you see.
Absolutely. Was it Andrew Steele who said that the soul of man seems to dwell in the fascia?
Probably. I should have that in my book. That's a great quote. But
it's a really good one, yes, because
yeah.
we were trained in the fascia this much, so we knew how important it was. And so what I do as well is this fascial unwinding, which would be a little less light than the craniosacral work that I just described. And we would either see some spontaneous or help trigger or stimulate some fascial unwinding, and people would have these memories, and suddenly the body starts to move all by itself, and it's all magical and beautiful and impressive. In those cases, they actually realize something did happen during the treatment that day.
Yeah, and I think it's the context too, how, I don't know if you find that, because I mean, the podcast is about discussions on health and healing and, our everyday realities. But I think people come in how they are. And as long as you resonate and you become a very good facilitator, I think you can see where they go, what they want. And so I know, I'm not going to be sexist here, but a lot of guys, they just like, I'm in pain, get me out of pain, and that's it. But you have other people, and you have other guys, of course, that are seeing the world quite differently, and they want, that there's trauma, there's more. They didn't just get a frozen shoulder for no reason. There's more going on, or they're clenching because there's stuff going on. It's not only a physical manifestation, right? And so, yeah, to those people, it's like connecting the two for them allows, in my experience, it's like you're allowing them to liberate something larger. If you can be what's the word in English? If you can hold the space.
Absolutely.
That's all it is. If you can hold the space.
Yeah. Only in space can we heal. Only in this safe space.
Exactly.
I fully 100% agree with you. And of course, with these natural therapies, it's quite challenging to see any conversion in people's mind. It's the beauty of humanity. It takes them the time they need to. And to give you an example, this is something that obviously I saw in some clients, because they want to be cured then and there. They made the effort to come to something that they absolutely don't believe in. So actually the results should be spectacular. And it takes more than a session. Sometimes magical things, like for me, could happen on the first session, but sometimes it just takes a little longer, because we're all different. We have all the different history. And on a professional level, I was looking to rent a space in a different clinic, in a couple of different clinics recently. And I had a chat with someone who may be a physiotherapist. I don't really remember, but they wanted me to explain to them what craniosacral therapy was. And also, so I could feel that they didn't believe in it 100%, but they wanted me to give them numbers. How many treatments for such and such condition? Mm-hmm. So this is not something that we can put a number on. And I think whether it's the clients or even some professionals in the health field, it's really still, early stages for people to believe in a different way of healing that is just different from a number of pills, a number of sessions, results, black and white realities.
Oh, yeah. And it's being highly exemplified right now as well. It's like, right. Yeah, we're really in this, black and white, the ugliest faces of that paradigm are showing up now, and everyone's to be treated the same, and everyone's immune system has to go through this no matter what their own immune system does. And no matter even the research that shows, that if our immune system is good, then and possibly that we've had, whatever these things we can't discuss, that we're much more likely to even get sick. So again, it's kind of like the black and white, put it all together, and this is how we need to be, and we're a bunch of idiots, do this or whatever, and I think, we have to take personal responsibility as practitioners for our attitudes that keep reflecting that paradigm, and I'm thinking like and the physiotherapist in general. I mean, there's nothing wrong at all with science. There's nothing wrong with data, but of course not, and you can retroactively go, well, that person also had a hip problem, and which also got better, and also had a TMJ problem, which also got better. So, but the thing is, that's not how people come in to heal. A true healing exposes everything that needs to heal.
It's holistic.
And it's holistic. There is no way of, you don't come in with a laundry list. I mean, some people do, of things that are wrong, but the thing is, we heal in such an extraordinary and beautiful way, that can it be measured? Yes, I suppose it can be, but it's not our primary focus. And I would say the truth is, most people, they just want to get better.
Absolutely. Exactly. 200%. That's all, no matter how, and no matter how long it takes or what it takes, as long as they get better, this is the most beautiful end result. And yes, it is absolutely impossible to give a number, to put a number on humans, no matter what the reason. And the example of, I don't know, a sciatica issue on a 14 years old is not going to take the same number of session than someone who's 85 years old. Everyone is different. Everyone has a different history of injuries and emotional situations, that we bring along, all of us. And so, yes, I understand how this is showing during the situation that we are experiencing at the moment. And as you know, I'm from France and I live in BC, so I have a plethora
of observations possible,
of colorful observations. And
but I wanted to say here, because most people don't know this, right? What's happening in BC, which is so positive. And this is, again, whether you are the word we can't say or the word we can't really talk about, is there's a real parallel medical system that is based on healing that is starting. And it's pockets all over BC now, where nurses that are sick and tired of, having gone through already the pandemic, and now, even though they have immunity, are being forced to do things that scientifically makes no sense. It's not a stupid positioning. It just doesn't hold water. And there's people who don't want to because they don't want to. And then there's people who can't. And the whole point is we're humans. We have all our different reasons. And some people have looked at it and share the opinion with some of the leading experts that say that it's possibly dangerous. So there's a real large group of people that, we're not just one, and we don't all see the universe the same way. We don't all have that experience. But what this group of people are doing, they're joining with all kinds of healers of different modalities and giving anyone who is interested an alternate system. Because as this black and white system is happening, people who have not done their thing, or not not complied to mandates, and mandates are not law, right? They're just mandates. They become law when you comply, because that's an agreement. Then you're saying, yes, I will agree with the system. But if you don't agree, they're not law yet. They're just mandates. And it gives people who are not being treated properly because of their choice. And, I know lots of people who did it and will not give the information to others, whether they did it or they didn't, on principle that it's our private choice, and I really honor all of those people. It doesn't matter your personal choice. That's the whole point. But what these clinics are doing is they're attracting people who believe in medical ethics, who believe in having the privacy of one's own life kept to ourselves. So I'm seeing the positive side of what is truly a deeply corrupted medical system, which is, yeah, anyway, that's enough for my lecture.
When all of this started, I had a feeling that somehow it's gonna shed light on alternative, healing modalities. Isn't it strange when, everything is about, receiving a certain type of medical approaches at the moment, and it's absolutely universal. And at the same time, I was feeling, everything happens for a reason.
Yes.
And yes, it is actually shedding light on complementary health approaches, because we can work hand in hand. Absolutely, we always have. And so in the darkest of the darkest, there is always some beautiful light shining through.
I think we're going to end right here. Thank you for those beautiful last words, and thank you very much for being on this show.
Thank you for having me.
Thank you for joining us at the Healers Café with Dr. Manon. For more information, go to drmanonbolliger.com.